Okay, you may start.
Hello, good afternoon, Doc. Good afternoon, everyone. This is clinical pathology with the topic on clinical hepatitis. This is BGD group consisting of section D, groups 5, 6, and 7. So to start off, may I call on the representatives of group 5.
Good afternoon, Doc. So for case one, patient is a 20-year-old factory worker that comes in your clinic for a routine physical exam and gives you the following hepatitis panel results. So the HB-SAG is positive, anti-HPS is negative, total anti-HBC is positive, and IgM anti-HBC is negative, and HBe antigen is positive. So based on the results, the patient is diagnosed with active chronic HBV infection. And since the HB-SAG is positive, it means that the patient can spread hepatitis B to others through blood transmission. And since the anti-HBS is negative, it as well as the total Hep B core antibody is positive, it means that there is a previous or ongoing infection of Hep B. And since the IgM antibody is negative and the HBe antigen is positive, it means that there is an active replication of the liver cell of the virus in the liver cells and of the virus circulating the blood. So for the next guide question to be answered by Daryl Palma. I also the salient features is that the patient is 20-year-old and a factory worker.
So for differential diagnosis, so we have hemochromatosis and alcoholic hepatitis. So for hemochromatosis, it is ruled out because it is negative in jaundice, because patients with hemochromatosis will manifest bronzing of the skin, and also is negative in hepatitis panel. And for alcoholic hepatitis, is negative in is BSAG, the hepatitis panel. So for the for its final diagnosis, we come up with chronic hepatitis B infection.
Hello, good afternoon, Doc. So for the second learning objective, locate this event on the hepatitis B serological time course attached. So the significance of the different analyte that yielded a positive reaction on the serology was already discussed by Kim Manubag. So let me just reiterate those results in order for us to know the specific time course of the disease. So first analyte to be considered is the hepatitis surface antigen. So technically, it denotes an active acute or chronic infection. Next reactive analyte that was positive was the total anti-HBC. So in order for us to know whether it is an acute or chronic infection, we should look at the result of the IgM anti-HBC. So technically, IgM only appears when the infection is on the acute phase. So So meaning the total antibody or the total anti-HBC that is present on the patient upon testing is on the IgG form or the chronic state. Lastly, the relevance of the positive result of the hepatitis HBe antigen denotes that since it is positive, the virus is actively replicating. Therefore, the patient is infectious. So next slide, please.
Oh, tempa. Excuse me.
So for the pathophysiology,
Can we go back to the first slide? I missed out on the lab results. Saman to. Let's go back katong na labs. Okay. So HBS, okay, positive. Can you see my cursor? Wala no. You cannot see my cursor, no?
wala daw.
Wala no. Anyway, anti-HBS negative. Okay. So this means this is a chronic because IgM is negative.
Chronic
And
state.
HBE, chronic infectious.
Yes, sir.
So this is a chronic infectious. Okay. So that means HBS persists. Okay. So where is this particularly? Di man po makita ang
Basing
ano
on
na
the
lang
chart,
ano yeah.
sorry, the infectious months to years, months to years after the window period, though.
Yeah. So after the window period, in this chart, where is it? Where is this? So estimate lang. So here, going to the chronic,
Diyan na dapat sa ano to,
sa right side, right?
L-
Cannot
daw.
see the ano manggid. Yeah. Yeah, where is it? There. Okay.
Yes, sir.
Yeah. Going to the chronic side, kay, because it's not IgM anymore. Okay. So there. At the right side, because there you have HB positive, then total is increasing. Okay. And the HBS is persistent. Okay. There. So do you expect the antibody to the HB SAG, the antibody to the HB SAG to be present anytime?
Um, Dili pa siguro, Doc,
Dili
since
pa. As long
as, as long as wala pa siya sa recovery phase.
okay, as long as HBS, if the HB SAG is still positive.
Yes,
This
Doc.
is what's nice with hepatitis. The antigen and the antibodies do not overlap. Okay, when you look at the charts of the serologic profile of hepatitis A, the RNA and the antibody overlap. For hepatitis C, the same thing. But for hepatitis B, if you already see the antibody, take a look. You have the HBE here. No, anti-HBE. So dapat wala na ni ang HBE somewhere here at the right side. Okay. So you will appreciate it in one serological profile that I have in my lecture video, no? So kana. Okay, sige, next. Okay.
So proceeding to the pathophysiology of the disease, so technically this is the start of the progression of the liver damage. So as the virus enters the host cells or the hepatocytes, technically it will proceed inside the nucleus for viral replication. So the result of your viral replication are copies of your hepatitis core to be recycled and enter again to the nucleus for another cycle of viral replication, and some of the hepatitis core will be packaged by your Golgi bodies to affect adjacent or neighboring hepatocytes. Aside from that, it will produce hepatitis surface antigens that will serve as hepatitis virus peptides that will in turn be detected by your antigen presenting cells. Now, these antigen presenting cells recruits your CD4 T cells and CD8 T cells with the recognition of your major histopathology complex to try and fend off the infection of the hepatitis virus. So you might ask, what is the relevance of the CD4 T cells or the downregulation of the virus to the pathophysiology? So technically, upon the recruitment of your WBCs to try and downregulate or destroy to cut off the viral replication of the virus, it will produce lots of cytokines in which it will result into the phenomenon called as the cytokine storm. Now, this cytokine storm, aside from trying to destroy the virus, it will in turn result into the destruction of your hepatocytes, which leads to apoptosis. Next slide, please. So there, as you can see, um, upon apoptosis or aside from that, in the process of inflammation, there will be oxidative stress to the liver hepatocytes, thus leading to apoptosis then. And of course, your Kupffer cells and your T cells will produce other cytokines that will signal the activation of quiescent hepatic stellate cells to be activated. Now, these hepatic stellate cells, upon activation, will try to undergo transdifferentiation with the use of your epithelial growth factors, your platelet-derived growth factors, and your transforming growth factors to proceed to transform into myofibroblasts. Now, these myofibroblasts will then be deposited and accumulate in the extracellular matrix of the liver and produce or secrete lots of collagen, glycoproteins, and proteoglycans that will aid in the fibrogenesis process, thus resulting to the fibrosis of the liver. So after that, if the chronicity of the disease or hepatitis virus infection will not be resolved, it will lead to liver cirrhosis and worse with your hepatic cancer.
So for the third grade question, estimate the prognosis of this patient. How would you advise him or her? So first off, for the treatments, uh, for acute hepatitis B infection, there is no specific treatment for this type. Care will depend on the symptoms, aiming at maintaining comfort and adequate nutritional balance. And for chronic hepatitis B infection, there is antiviral medications are available. However, this is not a cure for chronic Hep B infection. However, however, it can only stop the virus from replicating and prevent its progression into advanced liver disease. So, next. So the first line in the preferred agents for chronic hepatitis B infections are antiviral agents. Uh, these lower the progression of cirrhosis. They reduce the incidence of liver cancer and improve long-term survival. The WHO recommends the use of oral treatments, tenofovir and entecavir as the most potent drugs to suppress hepatitis B virus. They rarely lead to drug resistance. They are simple to take and have a few side effects. Example of these drugs are tenofovir and entecavir. They do not cure chronic hepatitis B infection, but they only suppress the replication of the virus. Therefore, most people who start hepatitis B treatment must continue it for life. So next are interferons. They are proteins that have antiviral, anti-proliferative, and immunomodulatory effects. They are man-made versions of the substance produced by the body to fight infection. Examples of these are pegylated interferon alpha. Next is surgery. So liver transplant is the treatment of choice for patients with fulminant hepatic failure who do not recover, and for patients with end-stage liver disease due to hepatitis B disease. So for the non-preferred agents, this consists of lamivudine, talbivudine, and adefovir. They are called non-preferred or second line or third line because these agents are associated with hepatitis B viral resistance. Vaccinations. Hep B vaccine is the mainstay for hepatitis B prevention. WHO recommends that all infants receive the vaccine as soon as possible after birth. The vaccine is of the inactivated type, given intramuscular. They are given in 3 doses in 0, 1, 6 months. You can, or alternatively given in 4 doses in 0, 1, 6, 12 months. Vaccination is highly effective as it induces a protective anti-Hep B antibody response in infants, children, and adolescents. For the next is for the prognosis. For acute Hep B infections, in most cases, people recover completely after the short-term infection. However, a small percentage of patients go to develop chronic Hep B, and for acute Hep B, the outcome is generally good. For chronic Hep B, among the long-term complications of Hep B infections, cirrhosis and hepatocellular carcinoma cause a large disease burden. Liver cancer progresses rapidly, and since treatment options are limited, the outcome is generally poor and complete cure is difficult. For counseling of chronic Hep B patients, the patient must cooperate with the source and source and contact tracing. They must visit the general practitioner in accordance with the applicable guidelines for referral. They must also follow hygiene measures in order to prevent the transmission. Uh, they must deal with solving and coping problems associated with its chronicity. They must also practice safe sex with partner until the partner has been vaccinated. The patient must also complete vaccination. Must have the members of the household to have complete vaccinations. Additionally, for students and healthcare workers who are Hep B positive, they should not be excluded from training because they have hepatitis B. Uh, they, they can still perform exposure prone procedures depending on the serum Hep B DNA level at 1,000 units per ml. They must not exceed these values. And additionally, other than practicing universal precautions, no special arrangements are indicated for infected children in the community settings unless they are prone to biting. And optimization of body weight and treatment of metabolic complications, including control of diabetes and dyslipidemia. They are recommended to prevent concurrent development of metabolic syndrome and fatty liver. That is all for the case one.
Very good. Okay, so um, practically, when you're faced with this kind of patient, look at first the occupation of the patient. The patient is a factory worker, right? So that means the risk of the work of the occupation with this kind of disease, okay, it's the risk of transmitting is low, okay, compared to a worker who is working in the hospital or a healthcare worker or a commercial sex worker, okay. But since this factory worker is still human, then he most probably he has a girlfriend, so still the same. You still have to advise for the be him to be careful, not resort to multiple sex partners, okay, and avoid any transmission, possible way of transmitting this, because take note, he is infectious. Okay, HBE, the positive HBE. This is very crucial, no, and dangerous. Okay, so let's give it a hand for the first group. So let's proceed to the second group. Okay, so what the phase here is chronic hepatitis infectious, infectious. Okay, so most likely this is in the what? Immune tolerance or immune clearance? Immune clearance or
Um,
immune tolerance?
immune
Napamay.
Immune
tolerance.
tolerance, Doc.
Immune tolerance. Tolerance pa siya. Okay. Wa pa man. Oh, perhaps the lacking data is the DNA, no? The DNA. Because in immune clearance, you already have a lowering of the viral count. Okay. And also, what's the other lacking data for us to classify if it's either immune clearance or immune tolerance? The liver enzyme. Okay, but basing on the data given, it's safe to say that it's chronic infectious state, either immune clearance or immune tolerance. Thank you. Next.
So good afternoon, everyone. Can you hear me?
Yes, loud and clear.
Yes, please.
Okay. So good afternoon, Doc. Good afternoon, Doc Lau and classmates. We are Section B, and the case two will be presented by groups 1, 2, 3, and 4. Next slide, please. So this is a case of a 25-year-old male farmer whose mother died of complications of active chronic hepatitis B. Next slide, please. So he presents with the following profile. So his hepatitis B surface antigen is positive. His anti-HBs is negative. His anti-IgN is negative. His hepatitis B core total antigen is positive. His HBe antigen is negative. And lastly, his anti-HBe is positive. Next slide, please. So later, this picture will be discussed by group 2. So next slide, please. So I am Tina Fe Aragon, group 1's representative, and I'm here to discuss, to explain rather, why there can be two possible interpretations with these results. Next slide, please. So our first interpretation is that the patient has active chronic non-infectious hepatitis B virus infection. And our second interpretation is that patient has past HBV infection. So why there can be two possible interpretations in this case? Next slide, please. Next slide, please. So it's because based on his serology profile, as you can see in the picture, he is before. Go back to go back. Okay, and that's it. So based on his serology profile, as you can see in the picture, he is HBs antigen positive. He is anti hepatitis B surface negative. He is anti-IgM negative. He is anti-HBC positive. He is HBe antigen negative, and he is anti HBe positive. Next slide, please. So, and because of this result, we came up our first interpretation that the patient has active chronic HBV infection, since it shows a reactive hepatitis B surface antigen and a negative anti-hepatitis B surface antigen. which indicates active hepatitis B infection. These are serologic markers to appear in a what hepatitis infection. Anti HBs is still negative because it only appears in a hepatitis infection. Anti HBs is still we call this one. So anti-HBs is still negative because it appears during the recovery period of acute hepatitis B a few weeks after HBs antigen disappears. Hepatitis B surface antigen levels peak during the acute stages of infection and detected as early as 1 week and as late as 9 weeks after exposure of viral hepatitis B, then gradually decline as the patient develops antibodies to the viral to the antigen and recovers. So this time course will be discussed by the next group, so do not worry. Positive anti-HBe usually indicates inactivity of the virus and low infectivity. And a negative HBe antigen result indicates very minimal or no HBV replication. So this means that the patient is non-infectious or unlikely to transmit the virus onto another person. Next slide, please. So since the anti-HBC and anti-HBE are positive, we came up that the second possible interpretation in this case is that the patient has past HBV infection. So we all know that positive anti-HBC and negative anti-IgM are markers of past HBV infection, di ba? So given this, it only makes sense that the IgM and that the IgM anti-HBC and the HBe antigen came out non-reactive because they are both indicate current or recent active infections. Next slide, please. So because of this, as you can see in the picture, no, therefore two possible interpretations can be assumed based on the farmer's serology profile. So may I call on Group 2's representative to discuss the next LO? Thank you.
Okay, let me just butt in a little. Okay, so para lang dili ma-misinterpret. So the past infection that is meant here is that the patient acquired this HBV in the past, okay? But we will not be assured na that the patient is already well, although not infectious na ang patient. Ana lang na siya. That's the ano. Pero that's good ha, because my answer is different. But that's good that you were able to think it that way, no nga past infection siya. But my answer, another take, another other my other answer is look at the let's go back to your previous slide. You have the previous pagad. Okay. Okay. Previous pagad. Okay. So you can take a look at the right figure, the figure in the right. Okay. So both are negative for the HBE, okay, and positive for the antibody of HBE. Okay. At the same time, we still have the persistent HBS. Okay. So these are the two. My answer, no, my answer is either the patient is in the inactive carrier phase or the reactivation phase. Okay? In active carrier, the patient is non-infectious, okay? But in the reactivation phase, although negative in HBE, patient is still considered infectious because the DNA levels, look at the red graph, begin to rise again, no? Despite the negative in HBE. Ana siya. Pero okay ra pod, acceptable naman pod ang unsa. Pero bearing in mind that the patient is still sick because in the one that you said before ba nga past infection, you just have to bear in mind that the patient is still sick ha. Dili siya nga past infection na at present patient is already well. Okay? Because HBS is still there, HBS antigen. Okay? Okay, sige sige. Next.
So for number two, locate these events on the hepatitis serological time course attached. So in our case, since the HB SAG is persistent, then there is a positive for anti-HBE. So our interpretation is in the chronic state. Then there is an increasing also of the serum markers, and it would fall to the, in our case, doc, it would fall to the immune tolerance and to the immune clearance where it is an immune active phase. So the phase is characterized by an HBV viremia, and it would lead to liver cell necrosis. So there will be portal-based inflammatory infiltrates, and patients with detectable HBE tend to have greater viremia than those who are HBE negative or anti-HBE positive. So there will be significant liver injury and cirrhosis then that will develop in this phase. So antiviral therapy is
Mark,
often initiated. Hello, Doc.
Mark, unsa gito ang data is HBE positive or HBE negative?
Kuan Doc, HBE, anti-HBE positive siya, Doc. So,
Anti-HBE
naibalik sa cohort sa
negative.
immune
Okay.
clearance.
Okay.
At
No,
inactive carrier,
for
gid.
immune clearance, both are HBE positive. Okay? It's only during the carrier nga negative na siya and the activation.
So
Yeah.
dili ni
So dili
stain sa
siya
graph na
clearance.
positive or
Yeah.
negative.
Yeah, dili siya basta malagi na pa ang sa Hep B when antigen is present, the antibody is absent. Then and vice versa. So when the antibody is absent, the antigen is present. Nga na ba? So again, anti-HBE man is positive, so it is already assumed na the antigen is negative.
Atong same tong imong unta interpretation, Doc, no?
Yeah. So naa siya
Sige.
gyapon sa carrier, no?
Sige, Doc.
Then
Sige, so
ang imong
explain
answer
na ako, Doc,
is
ang
immune clearance, no? So
ano,
immune
kuan, Doc, and
clearance,
inactive carrier, Doc, sabi sa
inactive
imong
carrier gyapon. Oo. Yeah.
sige, so for the
Inactive
inactive
carrier.
carrier, sige, Doc.
Sige, go. Sige.
Sige. For the inactive carrier, it has low or non-replicative. So it belongs to the inactive phase where anti-HBE antibody circulates. NHB antigen does not. Then serum aminotransferase are normal. So nag-fall na siya here. Then ang imuhang blood HBV DNA is also low. So as you can see, the DNA viral load nag ni from sa gikan sa taas, then ni lower na siya as low as 200 IU per ml. So these people are now called asymptomatic carriers and are at very low risk progression to cirrhosis or hepatocellular carcinoma. So however daw, these people may revert to immune active diseases. So mo na ni siya ang reactivation phase where it has HB antigen negative, anti-HBA positive. Then this will require a long-term follow-up for the doctor. So in some chronic HBV carriers also, HBs antigen and anti-HBs complexes circulate in the blood. Thus, the patients produce antibody but does not clear the virus antigen from the circulation. So, such these immune complexes may lead to extrahepatic complications. So, examples of these are your serum sickness-like syndromes, then like your glomerulonephritis and urticaria. So chronic hepatitis B is associated with significant risk of liver cancer. Then the possible outcomes of patients B are mga na to, Doc. So we would say that in our case, it has belonged to the inactive carrier and the reactivation phase, Doc.
So it's either the patient may be in the inactive carrier. So you ask the patient, are you symptomatic or asymptomatic? So if the patient is asymptomatic, then most likely patient is in the inactive carrier phase. Siya.
Sige,
And
Doc.
yeah, kay I'm trying to simplify things ba. Sige. Um to clarify lang ha, when I say the antibody is present and the antigen is not present, um, I'm talking about the net ba? You know the net, like for example, the antibody, you still have the antibody, but the antigen, you still have the antigen, but the antibody cancels it out. No, that's why Mark mentioned about the complexes. No,
Yes,
so
Doc.
when antibody and antigen meet, then that is considered zero, not counted. That's the immune complexes. Okay.
Okay, Doc.
So there, ana siya. So I'm just trying to simplify things mga nga na positive, negative, pero in actuality still have the the antibodies and antigen, but the when they meet in equal amounts, no, then they will cancel out. Okay? Okay, thank you for group. Thank you group 2. Mana na ba?
Thank you,
No,
Doc.
okay, next question. Thank you.
So for the question number 3, what other information or test can be done on this patient considering the route of infection and disease? So we will run laboratory tests to assess the liver disease or the liver function test. Next slide, please. So for the laboratory test, we have the CBC and the liver profile like the ALT, AST ratio, and the INR. And we also have the HBV replication test. So we will run HBV replication test to determine the status of the HBV infection, differentiating the active and the inactive disease states. The more HBV DNA, the more infectious is. It is still important to determine the HBV DNA to monitor the elevation of serum levels in reactivation phase. So next, we also have to run the anti-HCV and anti-HIV in those at risk to rule out the viral co-infections. So they have HCV and HIV have similar route with HBV. So these tests are essential in differentiating the disease considering the route of infection. So we also need to run the screening and surveillance for the hepatocellular carcinoma like the AFP and the ultrasound. That's all, Doc.
For objective number 4, cite an instance when HBe antigen does not serve as a surrogate marker for HBV DNA. As we all know that Hep B virus has 4 genes, the SP and X. The C gene will code for the HBeAg, and then in which the C gene has a pre-core and a core region. If translation is initiated at the pre-core region, the protein product is HBe antigen. That's why HBe antigen is a marker for HBV replication and infectivity. However, in the case of in reactivation disease cases, HBe antigen cannot be used as surrogate for Hep B virus DNA since it is undetectable and it never appears in pre-core mutations. When we say a pre-core mutant, it is a variety of hepatitis B virus that does not produce hepatitis B virus E antigen. So patients with such mutations in the pre-core region and who are unable to secrete HBe antigen may have severe liver diseases that progress more rapidly to cirrhosis, or alternatively, they are identified clinically later in the course of the natural history of chronic hepatitis B when the disease is more advanced. In case of reactivation of hepatitis B or reactivation of the disease, it refers to the abrupt increase in hepatitis B virus replication in a patient with inactive or resolved hepatitis B. Reactivation can occur spontaneously, but more typically is triggered by immunosuppressive therapy of cancer, autoimmune diseases, or organ transplantation. The exact mechanism on how the reactivation of the disease can cause HBeAg undetectable is unclear. That's all.
Very good class. Okay. I like the last slide, the explanation of the last reporter. Okay, so next, let's go to the next case.
Hello, good afternoon, Doc. Good afternoon, classmates. So we're the groups 1 to 4, and we'll be presenting about case 3 with acute HPV in core window. So next slide, please. So a 28-year-old female prostitute visits the city health department for issuance of a health card. Due to limited resources, only 2 markers were ordered with the following results: the HB-Sag negative and anti-HBs negative. So next slide, please. Next. So for the salient features, we have the age of 28 years old, gender, which is female, and occupation, sex worker. And the markers, we have HB-Sag negative and anti-HBs negative. So these results can indicate that there's an infection, and also there's immunity to, or less immunity to, the Hep B virus. So next slide, please.
Our diagnosis is acute hepatitis B virus infection in core window. So our basis for our diagnosis are: number one, the patient being a commercial sex worker, which is a high risk factor for acquiring hepatitis B virus. And her serological tests, her hepatitis B surface antigen and hepatitis B surface antibody both tested negative. So negative results of hepatitis B serology does not necessarily mean that there is no infection, because the incubation time may be as long as 6 months. So this is known as the window phase, where infection may be present in a transition phase when both antigen and antibody are transiently undetectable in the patient's serum and serological tests are normal. So next slide, please. We have here a table interpreting different HBV markers. Take note that the 3 important parameters in hepatitis B are the hepatitis B surface antigen, its corresponding antibody, which is anti-HBs, and hepatitis B core antigen, so antibody. So these 3 parameters can help identify active infection, recovery, and antibody status after vaccination. So the case stated that due to limited resources, only 2 parameters have been tested. So we have concluded that the patient has acute hepatitis B infection in the core window stage. Next slide.
Okay, so our diagnosis was acute HBV in core window. One possibility, though, however, is that that the patient was not infected with HBV at all, since all we have is the HBsAg and anti-HBs result.
Yes, yes, that's what I'm about to say too.
Yeah.
Yeah,
Yes.
sige lang. Okay, padayan, padayan.
So that could be one interpretation, that the patient does not have HBV. For the other ones, HIV, chronic HBV, and Hep C, those could be possibilities because she is a sex worker with many partners, presumably. So, yeah, that's all. And we can rule out chronic HBV in that case, since you would need a positive HBsAg. That's all, though.
Hello, good afternoon. Quick pathophysiology lang kay we've been discussing the pathophysiology of Hep B so many times already.
Master na
Okay,
gina
so
ninyo.
yes, okay. So your Hep B is transmitted predominantly by sexual contact or parenterally by contaminated blood products or congenitally during childbirth, also known as vertical transmission. So the virus invades the hepatocytes by fusing membranes together and releasing its capsid into the cell. So the DNA short strand of the virus then elongates and forms a complete double-stranded DNA with the hepatocytes DNA long strand. So that travels to the nucleus and transcribes viral proteins and especially HBS, HBC, and HBE antigens. Next, please. So here's an illustration of the process. So your HB surface antigen and your HBC antigen are recycled to produce more viral particles. However, your HBE is released into the serum and is a marker for active HBV replication. So there are symptoms for HBV. However, they are immune mediated responses because your own T cell and B cells will attack your liver hepatocytes, the infected ones, predominantly by CD8 cytotoxic T lymphocytes when it recognizes HBC antigen and HB antigen. Next.
So for the laboratory evaluation of hepatitis B virus generally consists of liver enzyme test, liver function test, serological test, and hematologic and coagulation studies that includes a platelet count and a complete blood count. So for the liver test, liver enzyme test, it includes the levels of alanine aminotransferase, aspartate aminotransferase,
I will continue na lang, Doc. So for the lab test for acute hepatitis B virus, first is the consist of the liver enzyme test, which includes the levels of alanine aminotransferase, aspartate aminotransferase, alkaline phosphatase, and gamma glutamyl transpeptidase. And the second laboratory test includes liver function test that uh, that that uh, that evaluate the total and direct serum bilirubin, the albumin, and the measurement of the international normalized ratio. And for the serologic markers or test for hepatitis B, it is consist of hepatitis B surface antigen, hepatitis B core antibody, immunoglobulin are required for the diagnosis of acute hepatitis B virus. And lastly, hematologic and coagulation studies. So here are some of the interpretations. We lifted it in the CDC. So next slide, please.
So for the prevention and treatment, for the prevention, hepatitis B can be prevented by getting a vaccine at birth, probably within 24 hours. But it's also important to practice safe sex, always practice good hygiene and proper hand washing, proper sterilization of medical equipment, know the health status of your partner to protect yourself from STDs, avoid sharing of needles, and make sure to screen blood from donors before transfusion. Next slide, please. So for the treatment, there is no specific treatment for acute hepatitis B. But for people with mild symptoms, healthcare providers usually recommend rest, adequate nutrition, and fluids. Therefore, care is aimed at maintaining comfort and adequate nutritional balance, including the replacement of fluid loss from vomiting and diarrhea. Most important is the avoidance of unnecessary medication such as acetaminophen or paracetamol, and medication against vomiting should not be given. And if symptoms progress, treatment includes injection of immunoglobulins, interferon injection, and antiviral medication. That's all. Thank you.
For the management, you can use prophylaxis. Currently, hepatitis A, B, E active immunization with vaccine is preferable approach to prevent it. If ever HB-SAG positive patients, counseling should be received to prevent HBV transmission to others, and then dietary limitations. Patients with acute and chronic hepatitis with cirrhosis have no diet restriction to protect the liver from further harm. HB-SAG persons should avoid or limit alcohol consumption, refrain from starting new medications, including OTC, herbal medicine without checking their healthcare provider, and obtain vaccination against hepatitis A. That's all.
So for the prognosis, the infection usually resolves without treatment and most adults recover completely. Fulminant hepatitis may appear infrequently, 1 to 2% of patients with clinical hepatitis in type B infections. Nearly 10% of patients with acute viral hepatitis type B develop either chronic hepatitis or cirrhosis.
Okay, Dan. So what will you do when you have this? If you are the doctor, then you have this kind of patient who just presents you with a negative HBS and an antibody negative for the antibody, and she would like to ask for a medical certificate. Would you approve? Would you give her an approval?
Can you repeat the question again, Doc?
Okay. Okay. So if you were the doctor in the case and you have this kind of patient and you didn't order, you are not the one who ordered the test. Okay. The patient came in, the commercial sex worker came in, just handed to you a lab result of a um, HBS negative and anti-HBS negative. Ikaw, what will you do, Gordon?
I don't think I would approve, Doc, of it or give her the health certificate.
Okay, so what else will you do? I mean,
Kwan, Doc, ask for another serological testing for
okay,
IgM anti-HBC or total anti-HBC.
okay. So you can ask this total anti-HBC by this time will be the one that remains as high will be positive, no? Mara na siya ang positive at this time sa window period. Or you can tell the patient to come back after like 6 months, 3 months, okay, and see if the patient will develop will have this HBS, okay, incubation pa man, window period pa man, sorry, window period pa man, 'di ba? Ana. Okay? So any questions? Any questions? So what are the other possible scenarios when you have a negative HBS and negative antibody to HBS? It's either, di ba, four kabog, first is window period, second is a false negative,
False positive.
false
False
positive,
positive for
false positive ba? False negative.
for anti-HBC.
Okay. Next is if the
Low
patient
level
has,
chronic past infection, though.
okay, not really past infection, but
Resolved infection, though.
a
Low
result
level chronic
infection.
infection.
Yeah, kana no. Or if patient has HIV, no, the patient will not develop antibodies. Okay, it's in the lecture. Upat kabok scenarios for that kind of result. Okay. Sige, any questions? Any questions about the case? So, the answer to that is either you request another lab the total anti-HBC, or you can tell the patient to come back after how many months. Okay. Okay, next. Last one. Na, no?
Good afternoon, Doc.
Afternoon.
Good afternoon, classmates. So, this afternoon, we will be reporting about case 4 from section B of group 5, 6, and 7. Next slide.
So for case 4, you were able to examine a 40-year-old carpenter as a requirement for renewal of his employment. His hepatitis profile results state HB surface antigen positive and HBC total positive and HBC IgM positive, HBe Ag positive and HBe negative and HBs negative and an HBV DNA value of 200,000.
So the chart will be discussed later along the way. Next slide, please. We will be answering these questions with the first question to be answered by Miss Doc Donna.
Okay, so thank you, Doc QB. So for the first question, is there a reason for the patient to be alarmed? Why or why not? Next, please. So yes, there is a reason for the patient to be alarmed because he or she has acquired acute hepatitis B. So we came up with this answer due to the given hepatitis profile results. So the patient was found to be positive with the hepatitis B surface antigen, which is the first marker to appear in the serum of patients with acute hepatitis B. And the patient was also positive of hepatitis B core antibody, which is an antibody that is a marker of a prior HBV infection, as mentioned before by the previous group. And it is also detectable in the serum shortly before the onset of the symptoms, which is also concurrent with elevation of serum aminotransferase levels. The patient was also found to be positive of the hepatitis B E antigen, which correlates with a period of intense viral replication and hence maximal infectivity of the patient. Next, please. So the patient is negative for hepatitis B E antigen or antibody, which is not detectable until after the antigen disappears. The patient is also negative of hepatitis B surface antibody, which does not rise until the acute disease is over and usually is not detectable for a few weeks to several months after the disappearance of the HBs AG. So 200,000 HBV DNA was also found, which is a reliable marker of active HBV replication and is detectable within a few days after infection. So that's all for question number 1.
So for question number 2, we need to locate this event on the hepatitis B serological time course attached. So again, our patient has HBs antigen positive. So it's the red one. It's the red arc. Then anti-HBC total positive, the black line. Then the anti-HBC IgM positive, the purple one. Then we have HBe antigen positive, which is the green one. And we have anti-HBe and HBs negative, the light and the dark blue one. So we with the result, we have located that the patient is in acute phase of hepatitis B infection.
it has to be emphasized that the patient is in acute infectious, okay, infectious,
Yes,
since
doc. Because
HBE is
of
positive.
HBE is positive.
Mm-mm.
Yes, doc.
Acute active
Acute
infectious.
infectious.
Okay, sige. Thank you.
Okay, doc. Thank you, doc.
Okay, so for question number 3 is, would you allow this patient to work or not? Our answer is no, because the patient is currently experiencing an acute active infectious viral hepatitis B infection. So, regarding this patient, considering the lab results shown to us, especially the high viral load, we must take into account that this patient is at risk for developing hepatocellular carcinoma. We can advise the patient to hold off any employment concerns since there might be a possibility of exacerbating his current condition, and then for him to use a time to recover and undergo treatment, since he will typically present the prodromal signs of infection, including but not limited to anorexia, nausea, vomiting, fatigue, malaise, arthralgias, myalgias, headache, photophobia, pharyngitis, cough, and coryza, which may precede the onset of jaundice by 1 to 2 weeks. So that's all about.
What's the occupation of your patient here?
Carpenter, doc.
Carpenter, no?
Carpenter, doc.
Okay. So that's a dilemma because yeah, if the patient is really sick, then we can convince the patient not to work. But then if the patient is although very infectious but still is able to work, then he will really force himself. He will really ask you to allow him to work. And besides, his work is not related to it's just a carpentry. Lang. Actually it's a real dilemma. Yeah, and what will he feed his family if he doesn't have income, right? Especially during this pandemic, right? Ana ba? So answer may be yes, answer may be no. Okay? Depende lang yan. So if no, there has to be another breadwinner in the family. Okay? Any questions? Are you learning?
Doc, I have a question, Doc.
Yes. Saman.
In case of,
JJ.
like, for example, Doc, but the carpenter is in active infectious state, then na ay right makabalo ang iyang employer, Doc, that infectious siya na ang stage. Especially, Doc, for example, if naasa ka ng barangay setting, Doc, kay ang carpenter usually kay magtrabaho while na ang mga kuan, Doc, ilahang kuan sa balay. Like,
kung
the
by right,
employer needs to know.
I think the employer has the right to know. No? Ambot lang kay ang like before it's it has it's part of it's not really what do you call this? The request as part of the physical exam. No, it's in the physical exam, 'di ba, you have the basic 5. Pero ang the usual practice is they add this HBS, hepatitis B, even if the work is not health related or somewhat like kanang mga ingana no for example carpenter, they still request for HBS, no? Pero according to, I think there is this one law na we should not be discriminating people who are positive for hepatitis B versus those who are not positive, no? And there is this law, an anti-discriminatory act against hepatitis B patients, workers who are positive for hepatitis B. Pero the reality is, even if the work does not entail kaning mga needles it's just office work, the company or the employer still request for that hepatitis B test, no? And at the expense of the worker, huh? Which is actually that is illegal, no? Pero well, na it's being practiced naman, no? What is in the law is different from what is in the real world. Na wala lang nasakpan. Ana. So if the question is, does the employer have the right to know? Depends on the setting. If kung dili lang gud siya mag ano, needles, carpenter, then he will not be be involved in kining mga phlebotomy, di naman siguro. I don't think siguro. I don't know. It really depends on the situation. Pero if it's a health care worker, then of course, okay, another recourse to that, another the plan B for that is we will assign the healthcare worker to administrative position. We not in the in the wards, no, where there's high risk, or in the operating room, emergency room. Okay. Usa siya, it's a dilemma also. Okay. Any question, Jay? Clear? Dili siya clear, ha, pero
thank you,
what is in the law is different to what is being practiced, manggid. I know that kay left and right grabe ang pag-request sa hepatitis B i-add on sa APE na basic 5. Diba? Okay, any questions? Rex, any question?
Wala, Doc.
Blake, any questions? Natulog. Off ka mo, tanan. Ay, natulog mo, no?
Nagmata ra, Doc.
Bag walang mata? Nagmata. Okay, so any questions, guys? Any question? Okay, so I think for your section, this is the last meeting for CleanPath. Yeah, for this section. So your exam, CleanPath exam for liver function test, viral markers, will be on March 1. So, lang din. It's all in my notes. It's all in the PowerPoint. There is 60 items. I will give cases also. But it's easier compared to what we have in GenPath. Expect mga laboratory results. I will let you interpret. Okay? Okay, any questions? Okay, Nata, Gordon?
Okay na, Doc.
Okay na. Sige, let's call it a day. And thank you so much for coming.
Thank you, Doc.
Thank you, Doc. Have a good day, Doc.
Practicals tomorrow. Okay.